for us to get into the abdomen, you got to cut through the skin first, right? And that's just what I wanted to do. Remind you, you already, this is AMP2, so you're already familiar with the superficial aspect of skin. And then what's deep to that is muscle, right? So you have your skin and then you have your muscle. What we have to do is when you do a surgery and trying to do abdominal surgery to get into the digestive system, so I cut through the skin first. And then once you cut through skin, then you get to the muscle. Then you got to cut through that. And now you're into what you consider the peritoneal cavity. So we're going to do that now. You can have fun and it'll be a reminder of you what you learned in AMP1. For the usual cut for getting into, for surgeons to get into the abdominal cavity is this vertical cut here that's at the midline, right? Vertical. And so right here at the midline, you just cut right down here. So I'm gonna do that now. I'm gonna go to tools, all right? And this is how you do your cut. You go to tools and then you see it says cut there, right? So I'm gonna do that. Click on that, see, and when this green bar appears at the top, it's allowing you to cut. And then as soon as you're done cutting, you got to press done. So I'm gonna do that, okay? So what you do is you take your finger, right? And I'm gonna start right here, okay? And then you take that finger, you start here, you put your finger on the screen, and then you move it down as such, like I said, right? And now that's gonna be my cut. You see what's outlined right there for what I'm cutting. You know, usually it's just a cut when you're just doing a regular surgery, but here it's going to actually take this away. I want you to imagine like when I cut it, and when I cut it, this points out what part do I want to get rid of. And is it to the left of the line or to the patient's left of the line or the patient's right of the line? And that's where you press the scissors to the left. That's the part that I want to get rid of because I want to get to this area here. So I'm going to cut that and you'll see what happens. See? That's gone. Now, I want you to imagine that I don't get rid of all the skin here, right? What I'm doing is cutting right here, and it's just going to be the incision right there, and I'll be able to put my finger in there, okay, in that area, and then kind of move the skin so that I can get further in that area, okay? So I just want you to imagine I'm really only able to look in this area here once I get deeper and deeper. But for all good purposes of you guys being able to see what I'm actually getting to, it's okay that they're exposing everything here, okay? As you can see where I am now is basically I've gotten rid of the skin, so what's deep to skin is muscle. So if I click on this right here, right? But don't forget what muscle, I'm gonna click on this, but don't forget what muscle, what it has. It has epimysium, right? Remember we learned that in chapter 10? So therefore there's this sheath, like whitish looking sheath that's connective tissue, epimysium, that's surrounding the muscle. So I'm gonna go ahead and cut through that too. So I want you to see when you're doing real surgery, that's what the things you have to pay attention to, that's what you're cutting through. First you cut through the skin, now you see the actual, the epimysium, and now you're gonna cut through that, right? And then I'm gonna do that now, right? Let's go ahead and do that. Take the cut, I'm going to tools, cut again. And then I'm going to cut that part, right there we go. And then I'm gonna cut to that what? The left side of the patient. I'm gonna cut those scissors, click on those scissors right there. Now I got rid of the epimysium. Now I'm gonna try to do what? Next thing is deep to the epimysium is the muscle itself, right? So now I'm going to actually do the same thing again. And this is what I want to do. Go to what is that muscle right there that I'm having to cut, that I have to cut through. Look at that. You're reminded of what? AMP1. That's the rectus abdominis. Okay, so I'm going to have to cut through there. I'm going to go ahead and go to tools, cut that, and now we get deeper and deeper, right? So there we go. I'm going to cut there. Here's the scissors to the left there, and then I'm gonna cut that part, and there we go. I'm getting deeper and deeper. And there's something here where I'm getting into, for all good purposes, this is kind of all you see when you do abdominal surgery, but for what we want to see, I want you to get used to the anatomy. So I'm gonna like push this muscle to the side. In fact, I'm gonna hide it, right? Which happens to be what muscle from AMP1? That happens to be the external oblique muscle. right? So you got to get through muscles before to do abdominal surgery to get into the abdominal cavity. And so that's the external oblique. I'm gonna hide that, right? All right. For all good purposes, this is not what a surgeon does, which is get rid of all the muscles, right? So I'm just doing that for all purposes so that we can see everything a little better. And now this muscle that's deep to the what? External oblique is the internal oblique, remember? That's coming from the iliac crest there. I'm going to hide that too so that we can see things a little better, of course. In real surgery, you're not really getting rid of the muscles. And then what's deep to that is your transverse abdominis, right? So very good, right? This is just like a review just to see what we have to go through to get to abdominal cavity. Transverse abdominis, let me hide that as well. And now we can see some of the digestive system here, right? So now what we're going to do is, and I'm going to take my fingers again, and I'm going to what? Spread them apart. Once they're on the screen, that's going to magnify, right? Now we get a little closer. Turn the patient a little bit to the right so I can see things a little better. And now where are we? We're where I just showed you where we have the, and this is really what I want to do this as well, which is, let me go to digestive system, because truly, when you press the plus sign all the way, you really, this is what you see though, right? So even though I cut through the what? Abdomen, when I cut through the rectus abdominis, what I should still see is this. This is AMP1 chapter 1, right? And what you should know, this is called the, and let me show you, right? I'm gonna click on it. This is called the what? The peritoneum. And what type of peritoneum? It's the one lining the actual abdominal cavity, which is actually lining these muscles. So that's the actual what? Parietal peritoneum, right? So this should remind you. So we have to cut through that as well, right? Cut through that. I'm gonna hide that. And now we see, now where are we? Now we're in the actual abdominal cavity, right? All right, so I'm just gonna get rid of some things here. This is the greater omentum, as you'll see in the lab review, which is kind of like this peritoneum that's like extensions of a peritoneum. And it's kind of coming from the stomach there, and it hovers over the intestines. I'm gonna get rid of that so that we can see the actual intestines. These are the intestines here. We have different parts of them, as you'll see in the review as well. This is the actual really long portion called the jejunum. And I'm going to go ahead and hide that so we can see things a little better. And by the way, these things, jejunum, the small intestine jejunum, and what I'm about to click on here too as well, and kind of push to the side here. I'm going to press hide again over here on the top left, hide. And so what usually the surgeon does once they get into that little place where they made the incision, they can move the intestine around. You know, once you're in there, you can move it around, move it far away from where you want to resect, right? So that's the typical process of a surgeon in the abdominal cavity. And so what I did for all good purposes is kind of what they do with their hand is kind of move it away. So I just hid them, right? I hit it, push it to the side there. And another major component is another extra part of the peritoneum, which is called this mesentery right here. And I'm clicking on turn green, mesentery. It's actually attached to the small intestine that I just got rid of. And it's like attaching the small intestine to the posterior abdominal wall back here, right? And so that's making sure that the intestines can't just spill out of the body, right? If it was open like I have it now, it's attached to the posterior abdominal wall with this mesentery here. And what is mesentery and omentum that we just went through? That's like extensions of the peritoneum, right? I'm going to go ahead and hide that, because what I would love you to see at all these vessels, blood vessels here. And if you look closely, you can see this very important blood vessel here, right here, which is actually the abdominal aorta back here. That's the abdominal aorta back there. And so, you know, when you did cardiovascular system and the AMP1, that's it. I'm gonna get rid of this what you call peritoneum here as well, so that you can see it even more, right? There's again another peritoneum portion here. I'm gonna hide, and now you can see it really well. You see now this is the abdominal aorta that comes from the heart, comes all the way down the abdomen, right? And what I wanted to point out was a very, very, if I see cancer here, here's the cancer, right? So if I have it on my sigmoid colon, I'm gonna have to, whenever a surgeon does surgery, they have to now clip off the artery that supplies this, right? Imagine I get rid of this portion of the colon, and then blood is still coming to it, right? You don't want that, right? Then you'll lose blood, because the blood is going to what? Nothing. So what a surgeon usually does is looks for the blood supply of whatever they're removing, and they have to clamp it off. And that happens to be this very important artery right here, which is going to have branches come from it. You see these branches right here? I'm actually outlining with my cursor. These branches, which are called like the colic, left colic arteries, are coming from this main branch artery from the aorta called the inferior mesenteric artery. So it's good to know that like a lot of the left side of a colon, all of that blood is coming from this major artery called the what? Inferior mesenteric artery, because we're on the left colon area here, right? So all these branches come from it. Like this is the left colic artery here. And you also have, oh no, let me click on it like that so that you can see what I mean. Oh, it's not letting me do that. Let me try it again. Okay, it was clicking on something behind the actual. There we go. See how it says left colic artery? So these arteries, all of these here, that one, all come from this one here, which is the left. I'm sorry, which is the inferior mesenteric artery. So you're gonna clip that. We gotta clip that with a clip, right? It really is dissecting it, right? You're dissecting it, cutting it, and then we're saying, okay, let's clip the part that is still kind of coming off of this aorta. And now that stops the blood supply from coming to this area.